Thank you all for joining us as part of the our deep dive information session on the Senior Healthcare Support Worker Level 3 Diagnostic Imaging Support. As you may or may not know, the Senior Healthcare Support Worker has had multiple pathways for many a year, and they've been increasing those pathways. And then the most recent one has been the Diagnostic Imaging Support, which we're quite excited about. The aim and objective of this webinar and this deep dive is to give you information about the program, about the model of delivery, the structure, and really we'll also go a bit further deeper into actually the content that's involved within the program. We're hoping that we find this useful. I'll start with a few introductions. My name's Oliver Hill. I'm head of apprenticeships and commercial here at Dynamic Training. So my role is fundamentally is responsible for all provision in terms of delivery, both apprenticeships and other program, including, for example, our Oliver McGowan tier 2 training that we're delivering across London and the Southeast. Maisie, do you want to introduce yourself?
Yeah, I'm Maisie. I am a skills and development coach here with Dynamic. I'm a midwife by trade. I also worked as a diagnostic imaging support worker during my training as a midwife, and I am an Oliver McGowan Tier 2 trainer also.
Fantastic. Thanks, Maisie. So for those who don't know a little bit about Dynamic Training, Dynamic Training are an established apprenticeship training provider. We've been in existence in 2007, delivering apprenticeships, adult education and bespoke training solutions, specifically focused within healthcare and the NHS. Any one time we're supporting circa 500, currently at 586 learners on program at any one time across a variety of apprenticeships and other programs, delivering to now well over 80 NHS trusts across our provisions, be that within our healthcare provision, which includes the level 2, level 3 senior healthcare support worker, peer workers, community health and wellbeing, our healthcare science provisions, levels 2 and 4, assistant and associate, our healthcare support programs, which are business admin, customer services, facilities programs, and learning and skills teacher. Some of our NHS trusts, we have 1 or 2 learners, for example, on our science programs, where others we have multiples, 10, 15, 20, 30 learners on senior healthcare support worker being our biggest program. We are accredited across a plethora of different accreditations from Matrix to Skills for Health Quality Mark. And we also, as per any other further education provision, be that colleges, independent training providers or others, we are inspected by our friends at Ofsted, and we were last inspected by Ofsted in September 2021, where we retained and continue to retain our good rating. And we expect our friends at Ofsted to come and see us at some point in 2025 to 2028. And as an organisation, we are part of and are owned by Kelder Holdings, or a large Dutch welfare to work organisation, of which we are solely the UK arm of that. So I want to go straight into the diagnostic imaging support worker role. So as a role, I'm not going to tell you what a diagnostic imaging support worker is. I think that would be unnecessary based on the people we have on the call today. But I do want to put what, in terms of the standard, what it states that the learners must be. So the apprentice must be providing care and support for individuals through screening programs, elective and emergency diagnostic imaging examinations, including interventional procedures, as part of a multidisciplinary team in hospital and community sites. They must be supporting individuals and help to manage the equipment used for imaging procedures. That's including must be supporting individuals and the team before and during procedure, reassuring people if they are anxious and helping them with post-procedural care where necessary, and must be work in strict legislation and other guidelines designated to protect themselves and individuals in their care. As part of the apprenticeship programme, learners will achieve the actual standard itself, the Senior Healthcare Support Worker standard at Level 3 certificate, the Level 3 Diploma in Healthcare Support, which is currently delivered across the Senior Healthcare Support Worker pathways, but the difference being specifically that there are optional units available specifically for diagnostic imaging, and learners will achieve functional skills at level 2 in English and maths equivalent to GCSE A to C if they are not already exempt as part of that program, and learners will be required to complete initial assessments to identify what level they're currently working at if they are not exempt, so to enable us to identify if they are suited to the program. the basic rule of thumb of that being that the learners cannot be more than one level below the required level of functional skills. For those that aren't who are on the call that aren't, au fait fully with the apprenticeship funding rules, exemptions for functional skills includes GCSEs, O levels, CSEs, A levels, functional skills themselves, key skills, qualifications, and adult and numeracy literacy qualifications, as well as qualifications from other countries, as long as they have an equivalency called a NARIC or ENIC certificate that they can get. So we're going to go straight into the core content of this apprenticeship program. So this is our delivery matrix for the apprenticeship program. These slides will be shared with all, so you can have a real good look at this after. The program is 21 months in duration, which includes endpoint assessment. We'll get onto that later on, with functional skills being delivered in partnership with the other core program deliverers within the first 9 months of that program. Workshops, so the first 9 months of workshops are the standard workshops as part of the senior healthcare support worker program. Every senior healthcare support worker, irrespective of pathways, will complete these workshops. Includes orientation workshops, which is understanding our online e-portfolio systems, how to embed good study skills into the program, before going on to developing skills and knowledge of the apprenticeship standard. So that so the actual standard within the senior healthcare support worker, so duty of candor, clinical effectiveness, personalization, looking at personal, people and quality improvements, then health and well-being as a separate component, which includes clinical tasks, accountability, communication, indicators of good health, mental health and well-being, and then the really key, which we're going to go on a bit later on, that service improvement research project, which is a component of all of our senior healthcare support workers, and really is a piece that we want to embed specifically within diagnostic imaging. We've got separate slides to discuss with you later on. We're then moving on to the diagnostic imaging support. So this is covering specifically the standard, and what we're trying to do is interweave the standard with the units of the with the actual diploma at the same time where possible. So first unit being ensuring safety, quality, and patient well-being. So the topics we've just broken down these in quite obviously a lot more detail to these in the actual standard, but broken this down into the areas that are specific to this component area. So difference between ionizing and non-ionizing radiation, implement fluid and nutrition protocols in alignment with imaging procedures and patient conditions, safety protocols in the imaging environment as part of that workshop. And then ensuring safe medical practices and procedural excellence. So things like understanding diagnostic imaging support protocols, define the roles in the safe supply and administration of those medicines, analyze risk and implement mitigations, and understand protocols for post-imaging care. The advancing proficiency in diagnostic imaging support workshop covers areas such as identifying and analyzing common pathologies affecting different body systems, signs and symptoms indicating deterioration in health and well-being, including mental health awareness, which is a key component of all of the senior healthcare support worker and aligns directly with the workshop within the mandatory core units. And then local systems, risk management and well-being considerations, implementing safety, patient safety protocols, addressing the impact of mental and physical capacity on interventions in diagnostic imaging. As learners then progress through each of these workshops, complete their online learning, complete their workbooks, interweave that within the assessment through the diploma, which we'll get to in a moment, the learners will then progress through to their mock endpoint assessment before gateway and endpoint assessment. I'll jump onto endpoint assessment in a moment, as I have a separate slide about that. So just breaking down the slide before, I thought be logical, both in terms of just to quickly run through, but also when these slides are sent to you, to have kind of the core and specialist training sessions separately on a separate slide. So 6 sessions under the core, and then a further 4 under the specialist, delivered across the duration of the apprenticeship program. And what we've done is we've got multiple sessions running throughout the year. So learners they will definitely do just that introduction to sessions, that orientation first, and then they will book themselves onto, as part of our planning meeting at the start of the program, sessions 2 to 6, which can be completed in any throughout the duration of that period of time, at any of those workshops, and then onto the specialist sessions when those core sessions have been completed. Again, then we've also I've put in here what the core and specialist units that have been chosen as part of the apprenticeship program for that diploma level 3. The mandatory are as set in stone. You can't move away from them. You can't take a unit out. You can't change it. They are the core units that are required as part of the apprenticeship program that meet the minimum requirements of the mandatory components of the apprenticeship program. And as such, the learners will be assessed, coached, and a big chunks of this will be delivered as part of the workshops, for example, causing and spreading infection. You saw the entire workshop on mental health, understanding mental health problems. So it directly reflects within. And then we have the specialist units. We have chosen these 5 units. There were a few additional ones that were a little bit more niche. Normally for our apprenticeship programs, we do widen those optional units to give more options for our learners, but just being open and transparent with yourselves, we want to keep this pretty tight at this point in terms of those optional units, because this is our first cohort for diagnostic imaging, and we want to ensure that learners are doing the same delivery model. There are a few others specifically around teacher training, so staff members who train and teach on the program. But for these specific units, we're focusing for this cohort just on these units as being the core units that will meet the requirements of the diploma in terms of the number of credits that are required to achieve. For those who just joined us, hi, welcome. We are recording this session, so you'll be able to catch up later on, and we will be sending the slides through to you. I said I'd go back to endpoint assessment, and I'm going to do a bit of backward and forward. So as part of the earlier on the matrix that showed the delivery of the program, we had those mock endpoint assessments, that gateway, and then the endpoint assessment. Endpoint assessment happens at the end of the apprenticeship program, and apprentices need to pass this to achieve their apprenticeship program. So the endpoint assessment involves assessment by a third-party organisation that for the program is observation in practice with questions, so observation in the workplace, and then a professional discussion underpinned by the learner's e-portfolio. For those who aren't fully au fait with endpoint assessment, I'm going to use an analogy, which is that look at the apprenticeship like you're learning to drive a car. You will have the trainer, skills development coach who will give you the knowledge, skills to enable to drive that car effectively and safely. And then at the end, the driving instructor moves away, and the driving examiner comes in and goes, "Show me what you can do. I'm going to observe you in practice driving that car. I'm going to observe you in practice being that diagnostic imaging support worker. I'm going to ask you questions about we didn't have exams and driving a car. They'd ask me, can I read that? And I'd say yes, and that was it. It was done. But that was the 90s for you, and driving cars. But it's about discussing the highway safety code of practice. For the endpoint assessor, they're having a professional discussion about their job role, the experiences they've had, the scenarios that they've been involved in specifically around senior healthcare support worker and diagnostic imaging as well as a thread of that. I hope that's helped in understanding endpoint assessment. So I'm going to just go back one again. So that's because of that, learners can pass, fail, or have a distinction on their apprenticeship program. And as such, we test as we go through the apprenticeship program continuously, assess against that learner's knowledge. Did they have that understanding of the training that's being put in place? Is it being developed in the workplace? We do mock endpoint assessments of that observation and those professional discussions during the end of their apprenticeship program. And we have that really essential gateway tripartite meeting between the skills development coach, the learner, and then the line manager stroke mentor of that apprentice, where we check knowledge, skills, and behaviours learned on the whole programme, and it's a tripartite agreement that they feel comfortable and they're ready to move through to the endpoint assessment. Where they're not, and we feel there are gaps in knowledge, either directly through our mock endpoint assessment or through the line manager, and they say, look, these are areas we have concerns over, then we go back, we put an action plan in place, and we retrain ready for that endpoint assessment, with the key focus that we push our learners, we stretch our learners to get distinctions rather than passes. So I'm just going to put up this is our apprenticeship journey. So all learners go through application, information, and information session. A similar to this with slightly less information, which we're going to go to in a minute. So the learners make an informed decision if the program is right for them. The phrase I should have tattooed on my chest is right learner, right program, right time with the right employer, making sure there's that line manager support as well. Learners then go through application eligibility check, assessments and inductions, both in terms of initial assessments, diagnostics, neurodiversity assessments, before we go into induct the learner, plan that program through the planning meeting, before the learners then are off to the races on program, off the job training, standard diploma, English and maths, assessment gateway, endpoint assessment, and then achievement. So dedicated learning time that's required as part of this apprenticeship program is that we will see that learner either face-to-face in the workplace or online using Teams, 2 hours in person for our teaching and learning reviews, where the learners will coach and be mentored in the workplace against the standard and the components that are being covered as part of that 10 to 12 week period, with learner and line manager or workplace expected to be present at some point for feedback, either face-to-face or via email. It's fine, but the idea is that we just want to have that communication going backwards and forwards about feedback. A key component for line managers engagement is those progress reviews every 10 to 12 weeks. That should be in face-to-face, where they are it's a three-way discussion involving the coach, line manager, and workplace mentor. The line manager is not expected to be there the entire 90 minutes, but it is about giving feedback, about understanding where that learner is on their journey and what training that's been taken place that then they can then implement in the workplace. So they're practicing those new skills that are being developed, and there's an understanding that those new skills are being given, or new knowledge being given, and how they are being implemented in the workplace. I'm sure you would all agree on the call that there's absolutely no value in having an apprenticeship program in any area if they're not actually then able to implement those into the workplace, and they're actually able to make a change or an impact in the workplace in terms of the knowledge, skills, and behaviours that are being delivered. Online workshops, approximately once a month, are subject to the program. You would say there's less workshops there. There's 10 workshops total, and it's a 21-month program. We do, however, offer enhancement programs in areas across a multitude of different areas within dynamic training. So, for example, one that I know is quite popular with senior healthcare is physiological measurements, or something that that our learners do go on as enhancement workshops. That's about stretching and challenging that learner's knowledge. Everyone's role is slightly different and have dual roles and responsibilities in the NHS. So we do want to go above and beyond just the standard to be able to develop that learner for the betterment of both the learner themselves and their progression, but also the department. And that independent learning time, minimum 6.5 hours per week required as protected study time, written into the off duty. So that 6.5 hours includes workshops over the duration of the week, the skills development, coach time. What I would advise and strongly put in is you actually have about 3 to 4 hours per week that at some point is set as study time for that learner. That will be ample with the other activity that happens as part of the apprenticeship program to enable them to achieve. The only caveat is if the learner does need functional skills, they will need more time because there are additional workshops depending on the need of the learner and what level they're working at. To be able to support that learner for functional skills. If the learner doesn't front load those functional skills, they don't get through that maths and English in the first 9 months, they are setting themselves up to fail. They cannot achieve their apprenticeship program. They cannot achieve their diploma without those functional skills. So it might be something you look at in terms of who you're looking to go forward, that it's actually those learners are exempt in the first place to go forward as part of the first cohort, and then functional skills is delivered externally. So I know a lot of you on the call will have external organisations delivering functional skills as a separate provision before they progress onto senior healthcare support worker. So we've thrown some examples, some of the teaching slides. So thank you to Maisie, who's been producing some of the content available as part of the program. Some of this here is not specific directly to diagnostic imaging. Some of it is, which you can see. Some of it is specific to the core units, but we try to make all of our workshops interactive. There's a lot of learning and a lot of content with each of the workshops that we're going through, making sure that there's things like quizzes, so we're checking and assessing against the learning that's taking place as we go along within the workshops, and then that's reinforced as part of the one-to-one skills development coach sessions and through the assessment of the diploma, which is why we like the senior healthcare so much. So you kind of have that double lock, learning and assessment. So Maisie, do you want to help and join me in terms of the impact of learning theory to practice and understanding of this program?
Yeah, sure. So we just want to make sure that whatever we are teaching our learners, that they're able to use that theory and apply it to their practice. So some of it is going to be quite general in terms of your mandatory units, which will be part of any kind of healthcare qualification. So gaining consent, risk assessment, understanding their role in quality assurance, which we're going to come on to a little bit more detail in our service improvement project shortly. But what we want to make sure is that your diagnostic imaging supporters are upskilling during this time with us. So they're understanding the importance of gaining consent. And they might be doing this all the time anyway during their current role, but it's more about understanding the why behind what they're doing. And we find that learners are getting more job satisfaction from understanding why they're doing what they're doing. So why do we need pre and post procedural checklists, that kind of thing? What is a good role model? How can they improve new starters? How can they get involved in mentorship? So they're finding that they're getting better job satisfaction from there as well.
Excellent. Thanks. I won't read through each of these, but this is some of the kind of the impacts we feel that the learning will have specifically to that. As May said, both the core learning as part of the senior healthcare, and there's some within here specifically around that diagnostic imaging support. So the importance of pre and post procedural checklists, for example, as part of the apprenticeship program. The key phrase that we're drilling home here at Dynamic Training to both our learners, our line managers, our employers, and our staff as well is about impact of learning. What is the value? What value can we show? And I think the key to that is that's a partnership between the employers and the providers to show that impact, to ensure that we're maximizing that opportunity. But also we want to be listening to you as practitioners about what impact you want to see from these programs. What do you want to see embedded? This is a new program in terms of those diagnostic imaging support because it's not been available. So we do want to hear from you about, okay, what else can we add into that? What can we build into this program? We want it to be ensured that it is as impactful as feasibly possible to be able to support and make that impact in the workplace. So please, when you get those slides, when you have a look at that program, do feel free to feedback. We do want to hear from you. As part of all of our apprenticeship programs, we're focusing on every single program has either an improvement project or an innovation project. Innovation predominantly falls around the healthcare science areas. So it's quite a key component. Maisie's going to jump in a moment because she does it on the ground and I don't pretend to. But we do want to make sure that improvement project is a key component of all our apprenticeship program. Do you want to jump in, Maisie? Because I will start whittling and you know this.
That's fine. So for our service improvement project, this happens at around month 6 of the program. We ask learners to complete one extended piece of work. So it's going to be a 1,500-word piece of work about an area of their workplace that they feel needs improving. So we then aim to bring this to life by encouraging the learners to share their thoughts with their mentors, their team members, their managers, and actually implement this service improvement project into their place of work, so that we can show that they're having a direct impact on service improvement and quality assurance. So we've put some examples here of areas that people have identified, with some of our maternity learners, for example. One learner noticed that it was difficult for staff to find equipment during emergencies. So her service improvement project was about color coding the stock room. So blue for oxygen, red for blood taking equipment. And this helped to actually streamline the care that was given to their patients. We've had standardized cleaning checklists to ensure that the quality of cleaning is followed by all members of staff, designing patient satisfaction surveys, which means that learners are getting directly involved with quality assurance activities. It could be something as simple as designing a QR code so that when patients maybe don't have time to fill out a written patient feedback form, they can take it home with them, or it might be on their appointment card or something like that. Um, it's also been identified that learners who work more predominantly with patients who have learning disabilities, they've considered sort of a simply explained leaflet, which means that leaflets are explaining the procedure with pictures. They have maps to the area that they need to go to in the hospital, larger font, and also a lot of learners have been involved with mentoring new starters, which is what's going to help them get their distinction at the end of their endpoint assessment if they can prove that they've been involved in this. But they have designed a skills and a CPD workbook to standardize the induction process. And it's been more valuable sort of coming from them because they know what is involved in their induction process and what they would want to see from a new starter who's going to be part of their team. So it's just an idea of the service improvement. I think, Ollie, we were saying about doing awards as well. I don't know if you want to talk about that.
Yeah, brilliant. So yeah, 100%. So I we've purposely across the organisation threaded in service improvements and innovation into every apprenticeship standard. Within the senior healthcare support worker, it fits really, really well because it's a natural fit into the standard. So we're fitting it across all of them. And then from that, we are going to be doing quarterly, 6 monthly awards for service improvement. So where we will be asking the skills development coaches, the line managers and or mentors of those learners to be able to nominate their staff on an improvement that's been made and the impact that that's happened. And then there will be awards and prizes accordingly for those for learners who win. And we're going to get the governors of our organisation. We have a board of governors as an education establishment to actually to read through those nominations and choose the winners from that. I think it's a nice thing to do. I think I'm really keen because it's such, we sometimes as a training provider, we forget the impact of learning that our delivery has and the phenomenal work that our learners do to support in the workplace. And I think it's only right that we start to really recognise that effectively. So just quickly jumping onto we said about e-learning tools and portfolios. I thought it's sensible to put a very bright picture up in front of you in terms of those tools. So we use OneFile, which is our e-portfolio system that enables learners to see where they're at on the program, the activities that need to take place, uploading of that work. And also, importantly, we give supervisors and or mentors access to that so they can see the communication happening between learner, line manager, skills development coach, and they can support with that work. They can't add in to that work, but they can see what learning has taken place and get involved in that in the program from there. Cognisys is our a neurodiversity assessment, diagnostic, and e-learning tool to support learners who are neurodiverse, and Skills Builder specifically for our functional skills, maths and English, both in terms of initial assessments, which explains what level the learner's at, the diagnostic that really drills down the specific areas to support the learner needs, and then from there a learning plan, an online virtual learning environment that is supported by the skills development coach for the learners to get through their functional skills. But in addition, those learners who do have additional support or have additional learning needs, we do have skills development coaches who deliver in small workshop delivery for maths and English across our program. So as I said earlier, I've jumped one ahead a little bit, but employers will have access to that to view learners' OneFile, and in learner journal reflections are a good way of seeing what is happening at floor level and identifying any changes that need to be implemented. And these reflections can often form the basis for team learning days and CPD. And we are offering monthly repeated training sessions on using OneFile for line managers or mentors in the apprenticeship program, because we do think when we see that learner and that line manager or mentor using OneFile, it's so powerful because they're both involved in that learning. Maisie, do you want to add anything in terms of those reflections at all?
We encourage learners to reflect weekly in their learning journal just to make sure that they are applying their theory to practice. It's also good practice to start getting them involved in this, especially if they're thinking about going on to further education, to higher education, because it underpins their knowledge going forward. So how to reflect is so important. So we have, as skills and development coaches, we teach them how to reflect. We stretch and challenge their knowledge on reflections and then encourage them to put them into their learning journal every week.
And reflections are part of the job learning that they will record on a weekly and monthly basis. So methods of assessment. After each training session, a learning assessment record will be released on one file with learner instructions, resources, and then given to learners that require support. And so assessment methods include workbooks, expert witness testimonies, competency-based assessments, professional discussions, and recorded prior learning. So the workbooks and passport workbooks that we use are specific to the standard that we're working on. So again, back to that thing of the core learning, and then diagnostic imaging support. So the learners are learning that work. They're reflecting on the learning that's taken place, and then they're showing evidence of using that in the workplace for assessment. And finally, I've used the word mentor and or mentor, line manager and or mentor a few times during this presentation intentionally. We are very conscious that line managers' responsibilities, that an apprenticeship is an additional activity that line managers have. And so we are advocating where appropriate that you have a mentor added to the learner, and those mentors can be used as really a powerful support vehicle for your learners to get through the apprenticeship program. So one of the trusts I'm currently working with, they've are advocating and using mentors who are learners who have actually just finished their nursing associate, and then they're going to go on to their nursing degree, but have got that gap in between, and they're actually going to be those mentors through the duration of their apprenticeship program as a kind of added skill set for that individual. As such, we're giving a 2.5-hour workshop on mentoring an apprentice. So that includes describing the structure of the apprenticeship program, similar to what we've gone through today, explaining the principles that underpin the mentoring process and how to initiate and establish a mentoring process with an apprentice. Been very well attended, and the feedback's been fantastic in terms of really supporting those learners. So when you're looking to implement this program, when you're talking to us, do think about, okay, is a mentoring an appropriate way to support those learners and get that set up at the outset.